Well, there are concerns over the increase of COVID-19 cases at institutions of higher learning. This follows a cluster outbreak at the University of Pretoria, where 115 students have tested positive for the virus since the 19th of March. While all organised student life activities have been put on hold, the university says it does not expect classes to be disrupted, as only a few first-year students were allowed back into residence, with the rest continuing with online classes. The Department of Higher Education's Wellness and Development Centre, Higher Health, has also warned of possible outbreaks across universities amid a looming third wave. Let's discuss this further then. We're now joined via Skype by Professor Ramneek Ahluwalia, who is the CEO of Higher Health. Prof, thank you so very much for joining us here on SABC News this afternoon.
Good evening, Flo, and good evening to everyone, and thank you for having me. Thank you.
You're most welcome. I worry that the numbers that we have there might be a bit outdated to date. Could you kindly confirm to us how many of those university staff or students have in fact tested positive for COVID-19? And then on the back of that, the other concern is that these students mostly have parents, which, at this time of the year they'll be going back to if they're not already at home and studying online. And many of those parents might have comorbidities. I mean, there must be concerns and fears around that issue too, isn't there?
So this is a very important alert that you're doing, and thanks to you for ensuring that we can reach out to parents, guardians, and young people across this country. The challenge is that these outbreaks, or this outbreak predominantly has happened before the Easter vacation, which means that some of the contacts that we are trying to trace might have gone home and might be meeting their families and might be in close contact and taking this virus unknowingly as carriers to the community in general. And that is the biggest challenge. If I recall the rage parties after the post-metric results that happened in Ballito, and exactly what happened after that was so many young people were congregated together, partied, super spreader event, and so many became positive at one time, and they went back to their families, communities, and then the second wave quickly sharpened much earlier than we anticipated as scientists in general. Now, these cluster outbreaks are a huge concern, for us. These are young people. In fact, I want to first of all apologize to young people, because this is their time. This is orientation month, induction. The first years have come. They have left their families. They want to mingle. They want to spend some time together. But in COVID times, it's not possible. So we need a social compact with them. And these super spreader events, these parties that they go into, bring these infections. And the reality is overnight, yesterday we reported 55 positive cases. And today we're reporting 116 positive cases, as I say to you right now, which is doubled. And the reality is, more we will contact trace, more we are testing young peoples together, more the results will become positive, because we are contact tracing the group of people who reside together, who live together. These are congregate settings. So when young people bring the virus into a congregate setting, they're residing with them, they're staying with them. So the virus moves very, very quickly from one person to the other. And that is where the new science has clearly shown that the new variants that are coming out from the global data are showing very high affinity to young people. If you look at South African data alone, the age group between 21 and 30 are the highest who are positive, followed by 31 to 40. Now, clearly showing that this virus gets high affinity to the young people, and young people are the biggest carriers of this virus and takes the virus to another outbreak into communities or families, or to people who are older, who are living with comorbidity unknowingly because they are asymptomatic or mildly symptomatic, and that leads to a huge third wave or a havoc that we just passed through in the second wave. I think the world is seeing from India right now, or Europe, that how the youth has been the epicenter towards carrying this virus into their outbreaks currently.
Yeah, Prof, what plans then have you put in place to control these sort of cluster outbreaks on campuses, especially balancing the fact that, the President has said, look, we're still on level 1. So on one hand, you have to be, you have to allow relaxation of the rules, because that's what the President said, but also at the same time trying not to make this spread any further than it already has. And as you say, I mean, we all know varsity life. At this time of the year, it's parties, it's fun times. It's very difficult to kind of not be together, as you mentioned. So I just want to know what's been put in place then to make sure that these cluster outbreaks don't sort of continue.
So we are on high alert. We know the 6th of April is coming. We've got not only University of Pretoria, we're talking about TVET colleges, CET colleges in informal settlements in rural communities. We're talking about rural universities. So every institution will be taking these first-year students or other students also coming back into the campuses. We have a sector where some of the education classes cannot be done remotely.
Yeah.
You can't teach plumbing, engineering, electrical remotely. So we have to embrace the fact that young people are going to come back into our campuses. Mm-hmm. So what we did last year, at the same time when we were in level lockdown 5, when we saw this virus coming into our country in a big way, and the first wave was in its peak or second wave came, we built an army of about 30,000 frontline workers, yes, all across the institution. This is the same team that is working with the local Department of Health, the NICD, the NHLS, WHO to trying to do the cluster outbreak. So the aim is these wardens, resident officers, our student volunteers, they are on extreme high alert that they know 6th of April is coming. They are trained on scientific protocols on cluster outbreaks or COVID in general. So they need to be absolutely vigilant, ready, and absolutely do what they have been doing over the last 1 year, which we have contained towards still running the institutions of higher learning, conducting exams, and still saving an academic year, which we have done over 1 year. We need to follow. As much as our fatigue is coming, resilience is breaking. But lastly, social compact. If these young people do not sign social compact with us, which we are trying to enforce, they're going to fail. Yeah. Because at the end of the day, this is a pandemic where youth has to support us as much as we can put all these systems in.
And you talk about the youth having to support you. That was, in fact, where I wanted to go. I mean, what has been the attitude? You talk about last year, and obviously there's also been some lessons that you've learned from last year. But I just want to talk to, the attitude of the students. I mean, are they supportive? Are they, for the most part, trying to adhere to the rules? I don't know how I would have adhered to them in my first year. That's really the last thing that you want to be doing in your first year, and in early parts of varsity is wearing of masks and staying away from other students. But what has really been their attitude? I mean, you obviously would have seen kind of the attitude from last year and moving now into this year.
They have done brilliantly over the last 1 year. You must be surprised. We've done 1.5 million South Africans on exams, on sites, across our TVETs, community education colleges, our rural universities, that predominantly we were challenged by remote learning processes. Yeah. So they have been very strong. They have followed the protocols. They have, alone 1.6 million students are registered on higher health check, that they are issued daily passport. They do daily screenings of COVID-19. Mm-hmm. They go through every symptom daily. As much as they are tired, they are fatigued, they are standing with us. But there are times where we also lose when the first years come, induction time, they're coming out of their adulthood. They know that this infection might not be as severe to them compared to the old people. And we lose out. We lose out to these parties. We lose out to these super spreader events. And we as much as they're strong with us, we fight. So what works for us is a 10,000 army of student volunteers, mm-hmm. which is standing with us, which is peer-to-peer networks of ensuring that the same information of COVID and the protocols move from one peer to the other. I think this period has been very challenging for this first 1 month. Yeah. And I hope 6th of April comes in a place where we can isolate early infections and break the chain of these clusters so that it cannot spread, and start with the new academic year with the new force of COVID understanding and protocols with these new first years, so that what happened last year is followed this year.
All right, Prof, it was a pleasure talking to you, and thank you very much for giving us some insight into what's happening, and obviously good luck, as the year does start for these varsity students, but also as we anticipate, what could be a third wave. So best of luck to you and your team.
Thank you. Thank you very much.
All right. That is Professor Ramneek Ahluwalia, who is the CEO of Higher Health, as, of course, there is that issue of the cluster outbreaks in terms of COVID-19 cases increasing at institutions of higher learning. And, of course, it comes on the back of the fact that varsities do indeed start to get busy at this time of the year.